So my name is Pundrique Sharma. I'm a consultant plastic surgeon in Liverpool and the northwest of England. So breast uplifts or mastopexies are operations used to lift the breast and treat sag, kind of do what they say on the box. And SAG is obviously a very common problem that women have, particularly following pregnancy or with weight loss. And essentially what you're doing is you're removing excess skin and redraping it to push it up and try and keep the volume up as best as possible, and also repositioning the nipple. As a result of how you have to do it, the primary disadvantage in many regards is the scarring, because you have to, whatever happens, you have to have a scar around the nipple. And usually there's a bit more scarring, often just at least one scar below the nipple as well. Okay, so the function of a breast uplift, as I mentioned before, is to uplift the breast. I'm trying to think of another way to put that, but that's what it does. And that expectation can, generally speaking, be met. That and repositioning the nipple. It works pretty well and pretty reliably, and it's got a very high satisfaction rate. It can also be used in conjunction with other procedures, for example, to address asymmetry, or with an augmentation to increase volume as well. And the sort of result you can expect very much depends on where you start from and what you've agreed to do with the surgeon. And the best way to address that is, as I mentioned many times before, talked about many times before, is to look at the surgeon's results, so you can get an idea what the future holds for you if you are to have surgery. That's in terms of the expectation. Now, the natural question, do they look natural afterwards, is a very tough one to answer, because it's really subjective. What I think looks natural may not be what you think looks natural. So I guess, again, that comes back to looking at results so you get an idea of it. I would say that the thing that they can look relatively natural, you can get relatively natural results. They're never truly natural. I suppose for me, the biggest thing that makes me think that is the fact that you have a scar around the nipple and downward. Now, that having been said, the scar can often be very, very good. But yeah, I would say that it's a very subjective thing, and it comes down to a good communication with the surgeon about what you're expecting, into what your feeling of natural actually is, and what the surgeon feels is natural. And look at some pictures. So how long does a breast uplift last? So that's a very good and commonly asked question, and it's very difficult to answer because it is inherently unpredictable, right? And that's very difficult to have to confess to as a surgeon. You can't give a definite answer. So the things that are going to determine how long it lasts are, why does a breast sag in the first place? It sags because of skin quality and because of volume and weight. So you kind of often you remove a bit of weight, so you're improving that a bit, unless of course you're doing it with an augmentation, in which case you're adding weight. And skin quality, well, by virtue of the fact that they've stretched already, often the skin quality is a bit thinner and more prone to sag as is. That having been said, I think most people, if you just have an isolated uplift, most people are still, I'll usually follow people up for a year or so afterwards. And at that point, it's very rare for people to be unhappy with the result. It generally holds itself to that point, but it isn't predictable, and it does depend on the individual patient and what else they're having done. Now, the other thing to think about is what really we're doing is we're kind of setting back the clock, right? So it's a bit like, but then the clock will start ticking again once you set it back. So while we might try and put it up, eventually it will go back. It will go back again. Is the surgery painful? Well, you would think so, wouldn't you? I mean, there's scarring you sleep for a couple of hours, and knife has been put to skin. But surprisingly not. I'm always surprised by how little it hurt. Most people are fine. They have paracetamol and ibuprofen, if that, for a couple of days. And that's, generally speaking, quite enough. So there are different levels of recovery, right? There's you're awake in the operating theatre after the operation, to I'm back to work or doing CrossFit or whatever it happens to be. And usually after the first couple of days from surgery, so the first couple of days people are uncomfortable and they kind of don't really want to move around too much. They can shower, but even then they're still not feeling 100%. After a couple of days, the pain has improved significantly, and they're getting back to things relatively normally, actually, around the house at least. Then after a week or two, they're feeling pretty good. It's kind of a dangerous time because people feel like, oh, I feel totally fine, I can just go back about activities as normal, but they can't, because they're still healing on the inside, and it's you won't be aware of that. You're just unaware of it. So you can usually get back to work a week or two later, depending on how strenuous your work is. But in terms of getting back to things completely normal, exercise, running, whatever it might happen to be, it's usually about 6 weeks following surgery. Does it leave large scars? Well, yes and no. So yes, the centimeters length of scars, I suppose, is relatively long, because you have to, at the very least, have a scar around the nipple. And usually there's at least a vertical scar beneath that. And then underneath that, there's often a little scar in the crease under the breast called the inframammary fold. So that's like an anchor type shape. So it's some combination of those. So in the terms of the number of centimeters, if you measured it, I suppose it would be, I've never actually measured it in total. But that having been said, they're not usually, let me stretch a bit, but they're not very broad scars. Often, I mean, depending on how you heal, which is very individual, you're not, they're not very broad scars. So it's not like a large surface area of the breast is covered in scars. And also, even with the scars, generally speaking, most people are just pretty happy with them. They're not really that bothered by the scars. So I kind of take my cue of, is the scars large, from how the patients react, and overall they feel however large the scars are, they're much better than the situation they found themselves beforehand.